Shoulder is a complicated joint, and shoulder pain is something we see commonly here at clinic. Anybody who's following us on social media for a while will know that I've suffered with a shoulder pain, and today I'm going to explain what we look for, how we treat it, and more importantly some exercises you can do at home. Now, roughly 75% of shoulders are caused by something called impingement, and this is of a muscle called supraspinatus, which is one of your rotator cuff muscles. The complication with the supraspinatus is it comes through a little tunnel. I'll show you on the screen here. If you look out for the little blue dot, the muscle comes through the tunnel, and as we bring our arm out to the side, it can impinge and pinch onto the tendon of the muscle. Now, this causes pain, inflammation. Inflammation causes more pain and more restriction in movement. So roughly 75% of the injuries we see in shoulders are here, and often people present with pain coming down their arm. So arm pain is the presentation. Now, the key indicator to this problem is pain coming from behind your back. So if you put your arm behind your back and you get pain, almost certainly there's an impingement syndrome going on there. Another test here is a test called Yoakum's test, where you put your hand up onto your opposite shoulder and lift your arm. Now, if this causes pain, again, you're making that space smaller, pinching on the muscle and causing the pain. Now, lots of people will say, I've got a frozen shoulder. Now, what is a frozen shoulder? A frozen shoulder will present in a very similar way, but importantly, you restrict on external rotation. Now, this is external rotation, bring your arm out the way out to the side. If you have restriction or pain on external rotation, then the likelihood is you have frozen shoulder. This counts for about 15% of shoulder problems. So the key to resolving these issues is to work out what the original issue is. If there's inflammation, we need to reduce the inflammation. And the classic sign of inflammation is if when you're laying on your side, it hurts. The best way to get rid of inflammation is to use ice. A bag of frozen peas, a freezer pack, anti-inflammatory gel, and if you're going to ice directly onto the tip of your shoulder, 5 minutes twice a day. The second way of reducing inflammation is with a pendulum exercise. Shown on the screen here, you will see hanging an arm with a very gentle, small weight and rotating your arm. Make sure the weight pulls your shoulder downwards and you're not lifting the weight back up. The second thing we look for is a restriction in movement. Is there a restriction in how far you can move your shoulder? If this is the issue, then we'll work on mobilization techniques and give you some exercises to encourage movement, using your other arm perhaps to push you a little bit further. Now, if movement and inflammation are not the issue, then it may well be stability. There's a saying, you can't fire a cannon from a canoe. If you haven't got stabilization or a stable joint, it doesn't matter how strong you are. So we build on stability exercises, and I'll show you some exercises here to build on stability, get your shoulder holding itself in a better place, and that's going to help you to build on that strength and to encourage your shoulder to stop impinging. Now, moving on to that, strength. If you have a stable joint that's not inflamed, and a stable joint that has full movement, we work on strength exercises, and this will be movement-based exercises, pressing, pushing, pulling exercises. You may well be doing this with a TheraBand. Again, I'll show you some exercises on screen here. And then finally, we move on to function. Now, functional exercises are specific to you, exercises that look like the things you do. So as you might know, I'm a cricketer, so a functional exercise for me would be with a band, looking like I'm throwing a ball. It may well be that if you're a gardener, for example, we get you doing more digging style movements. And as I said, specific to you, whichever sport or activity you do. So functional exercises will help us to work on stopping the problem from coming back. Now, hopefully this video has helped you to understand the shoulder and the complexities, but also given you a couple of tips to try yourself. Now, don't forget to like and share this video with anybody you know who has a shoulder problem, and if you've got any questions, give us a call.